Hello and welcome to my video on SSRIs. I will provide an overview of this medication class for anyone interested in learning more about them. This class of medication is one of the most popular classes in America and treats very common conditions. This video should prove beneficial to anyone looking to familiarize themselves with these medications. Firstly, SSRIs stand for selective serotonin reuptake inhibitors. That will be easy to understand once we talk in a little more detail about how they work. They do work in the brain and are useful for many mood-related conditions. They all work pretty similarly to each other with a few caveats. Their main use is for depression and the different categories under that. They are usually chosen first for treatment, and if one doesn't do the trick, trying another one is reasonable. Even increasing the dose further or augmenting with certain other medications is viable also. Some people do need more than one medication for depression, and adding on another medication with a different mechanism is also fairly common. Now, this class is not fast-acting in any way. 6 to 8 weeks is usually the minimum trial period for each drug at an appropriate dose unless side effects are the limiting factor. Really, the full effect can take up to 6 months, but most people know where they are at least by the 6 to 8 week time point. SSRIs are also very useful for anxiety. Since depression and anxiety go hand in hand, a lot of the time this is a benefit to most people. Now, if these are being used to only treat anxiety, typically lower doses are started initially. This is not so much because of effect, just that some side effects can actually worsen anxiety. So giving the body time to get used to the medicine before increasing the dose, if needed, is better in these cases. There are some other less common conditions they are used for as well, such as something called premenstrual dysphoric disorder, or PMDD, which is basically a severe form of PMS. Fluoxetine specifically, as well as sertraline, seem to be the better choice when treating this condition. Also, hot flashes for menopause can be treated with SSRIs, although paroxetine is the choice for this officially. Some other common and relative conditions are treated with these, such as PTSD, social anxiety, bulimia, bipolar, amongst many other non-traditional uses as well. Okay, now let's talk a little bit about how they do what they do. Their main concern is serotonin, which is what's called a neurotransmitter. Neurotransmitters are chemicals in the body that facilitate the communication of your nerves. Serotonin, simply put, regulates your mood, well-being, and how you perceive pain to a degree. SSRIs cause your body to use your own serotonin more. They do this by preventing a gate, if you will, from opening and taking up the serotonin your body produces. By keeping this gate closed, the serotonin is able to produce its effects longer before being whisked away from their site of action. The end result is basically higher serotonin levels, thus better mood. A quick aside to some of the differences between some of the SSRIs. Citalopram and escitalopram need lower dosing in seniors. Fluoxetine is the most activating, if you will, so not the best first choice for anxiety, but might be a good choice for a younger person or even someone that has a heavy drawback on their physical activities because of their depression. Paroxetine is the most sedating, so maybe someone that has insomnia might benefit from it without needing an additional medication to address that. Sertraline is the choice with cardiac patients, and vilazodone is what you would use if someone has OCD. What I'm getting at here is although these all basically are the same for depression and anxiety to a degree, other factors need to be considered because in medicine, one size never fits all. Individualization is paramount, especially with medications that affect the psyche. All that being said, it is time to talk about the side effects. I will focus on the more serious or common ones. Before I start though, I do want to point out that SSRIs are actually preferred because of their lower incidence of side effects. That might be a tad hard to believe once I'm done, but that just shows that other medicines for these conditions are even more side effect heavy. Biggest ones are classified under slowing down your nervous system. So being dizzy, drowsy, or sometimes just kind of out of it, or even confused. These are more common towards the beginning and will potentially go away after a couple weeks. These get worse with alcohol, so it is a bad idea to drink with these. Certain other drugs, such as opioids and benzodiazepines, can also make this worse. Another thing which isn't commonly talked about, but very common, is that SSRIs have a negative impact on sexual well-being. Decreased libido with males and females, erectile dysfunction, and difficulty or even prevention of orgasms. SSRIs can affect the rhythm of the heart as well. Typically not really a big deal, but when combined with other medications that also do this, it can become a point of concern. Likewise, they can increase bleeding risk with other drugs such as blood thinners, NSAIDs, and some herbal products. This class also cannot be stopped abruptly for the most part, as withdrawal symptoms usually follow. Anxiety, agitation, restlessness, and bad dizziness are just some of the common issues with stopping these cold turkey, if you will. Now, regardless of how long someone has been on paroxetine, it should be stopped slowly, or tapered down. But fluoxetine actually is the only one that doesn't really need to be tapered due to how long it stays in the body. I would be remiss if I didn't mention something called serotonin syndrome. It is something medical providers always worry about because it is serious, but rarely ever happens. Basically, if someone gets on too many medicines that affect serotonin, this can show up, and it is very serious. Movement issues, delirium, etc. It typically only shows up with high dosing and multiple agents. A few quick side effects to round it out would be that they can decrease sodium in the body, which can be serious for certain people. Should be very heavily considered in pregnant women, given that a serious outcome could be high blood pressure in the lungs, which is worse than that in the rest of the body, among other risks as well. They can increase the risk for weakening of the bones. Also, even though some can help with migraines, they can also cause a headache. I do want to point out a couple facts before closing out though. All of these should be taken once a day, doesn't matter with food or not, although vilazodone does need food, just that one. I mentioned this a little earlier, but these are not quick-acting medications, and they shouldn't be treated as if they are. I reiterate this because it is of my personal opinion that this is where one of the major warnings, called a black box warning, from the FDA comes into play. There is a warning that anyone under the age of 25 has an increased risk for ending themselves on this medication. I can only think that this is increased by the fact that they are very depressed, and then are told this medication will make them feel better, only to feel the same after a couple weeks. After feeling that nothing will help them, not even medication, their already negative thoughts are worsened. So that is why I stress that these are not quick acting. They need time to work. SSRIs are very common, and a lot of people benefit from these medications. They are one of the most prescribed medicine classes, so it is good to have a basic understanding of them. With that said, I hope this overview of the SSRIs has benefited you in some way or another. I do release videos fairly regularly on medications and pharmaceuticals, so if you like quick, concise overviews, I hope you subscribe so you can keep benefiting from my videos. Have a good day.